In this paper, we discussed image-guided optimization of robotic catheters for patient-specific endovascular intervention. Given an anonymized head CT, we use image segmentation to extract the ICA, which is a common site of occlusion in stroke patients. Next, we use principal component analysis and cubic smoothing spline to extract the outline of the ICA. When steering the robotic catheter along the ICA, our goal is to closely match the local shape of the vasculature. To do so, we solve for the joint values that minimize the local position and orientation errors along the inserted length. We validate our path planning algorithm by simulating catheter insertion into the ICA and evaluating the resulting position and orientation errors. First, we evaluate our ad hoc catheter design with unoptimized geometric parameters. This catheter design is able to generally follow the shape of the ICA. However, in regions of high tortuosities along the vasculature, there are spikes in position and orientation errors. The geometric parameters of the catheter affect its ability to follow the desired vasculature. To solve for the optimal catheter parameters, we use a design score that penalizes both the average and the maximal path following errors along the ICA. The optimized catheter parameters significantly reduce the average and peak errors along the ICA, both in position and orientation. Next, we explore the potential benefits of adding a passive flexure joint between the two continuum segments. Given this additional degree of freedom, we solve for the new optimal catheter parameters. The inclusion of this passive flexure joint further improves the tracking performance of the steerable catheter. Next, we evaluate the ability of this optimized catheter to traverse a type 3 aortic arch into the ICA. We selected and digitized a path through the aortic arch into the ICA, and we used it to create a combined path that includes both the ICA and the aorta. As you can see, the optimized catheter is able to successfully traverse the aorta and navigate the ICA. These results will inform future design iterations of multi-articulated catheters for endovascular interventions.